TAFA members, welcome to our first series in our virtual called Education Through Association. Now in this world of being in different places and locations and getting a chance and opportunity to speak to someone is such a great asset. So I'm so thankful for that. So for our first in our series for October, we have Andrew Burkhart. How are you today?
I'm great. Good to be here. Thanks.
Awesome. Thank you so much. So in a world of Texas, we got Houston and Frisco here. So I want to talk to you a little bit today about your hospital meeting the challenges on providing screening for patients, staff, and visitors with this whole COVID event.
Yeah. So, like many hospitals, when this first started, there wasn't guidance on what to do. And MD Anderson has the largest immunocompromised population on the planet. And so we took a very strategic and very dramatic, I guess you could say, approach is we very quickly did several things. We sent staff home, we stopped our research, and we really limited visitors to one visitor per patient, and eventually to no visitors as the pandemic moved forward. We shut down all of our entrances and then reopened only specific entrances where we put screening in place. And that was tough. I mean, people going home and not sure when they're going to come back to work, and researchers who dedicated their life to doing cancer research and not knowing when they're going to literally be able to go back to their laboratories and do research. I mean, within 48 hours, we stopped all of our research, closed and locked the buildings.
Wow.
So it was extremely challenging for our culture, but at the same time trying to maintain is I guess you could say as normal a patient experience as possible for those who still needed to do treatment. But I think we managed it well. We communicated really well as an organization with daily briefings from the president and emails, lots of information going out. Website was dedicated to sharing information about our operations on COVID-19. I think that really helped the institution overcome that.
Wow, that's amazing. So I know you had to probably think of all these things on the fly, and like you said, there was no guidance. So how did you do some of that training for those screeners and the things that you had to do to the building itself for that?
So like I said, we locked the building down. We sent a lot of people home, which put a lot of people in a tough situation, because some people can work at home, and we found that a lot of people work at home well. But there's a lot of positions that people, they can't work at home. They have to be on site. So we created an employee volunteer pool, and that became really the go-to for our first screening force. And like any endeavor getting off the ground, we started with very basic resources. We wrote and typed up SOPs, and we created simple training for staff to use. And we began that way, doing face-to-face training, and that moved into PowerPoints and PowerPoints online and videos and putting standard processes together. But that's how we were able to get through it. We started with what many people are still doing, and some people, started doing. Most started with hand infrared heat readers to read people's temperatures, and we've graduated some locations to standalone consoles where you walk up and it takes your temperature, to these kind of infrared cannons where it can read several people walking through a hallway at one time. And that's slowly how we progressed to dealing with volume intake, as well as making the screening situation accommodating to who was being screened and the volume and number of people screened. And that volunteer pool really saved us from scrambling too much, because these were employees who were dedicated to doing the job and doing it right, and giving back solid information and feedback as to how we can improve. And we like many people, change is something we just got used to every day, making changes to improve the throughput, the way we were screening, the efficacy of how we screened, and it's been successful, I think, so far for us.
Yeah, it's interesting how the technology changed even as we started. Just the thought process of from an old time thermometer to now we've got temperature canyons, which is kind of interesting how quickly this has moved on. So
Yeah.
how have y'all identified people that have been screened, those patients and visitors versus your staff? And then you talked a little bit about throughput, if you'll expand on that a little bit.
Yeah. So for patients or anybody receiving clinical care, they go through the screening process and they basically get asked all the same questions the staff get asked, but they get asked a few extra questions, and then they're given an armband or a wristband. And that's what identifies them as being screened. And they have different colored bands for different people, because we do have patients who are positive for COVID, but they need to be seen. And there's an operating procedure for that, and how they screen and how they get banded. So that's how we take care of our patients. Now for staff, we don't armband them or sticker them or anything, but as they screen in, they badge in. So there's a card reader at every screening station. And what we're able to do is take those badge screens, and we're able to compare them to other badge uses within the building. So most employees, if not every employee, ends up badging in to in some part of the building after they screen in. And so a report flags whether somebody screened into a closet or a floor, but they didn't screen in at the screening station or badge in at the screening station. And so that's how we ensure that our staff are screening appropriately when they come in. And like I said earlier, the technology changes, like the IR cannons, really help us deal with throughput. So we really try to let data help us make our decisions. So in regards to how we were acting in the pandemic, we were looking at CDC data and data we were collecting within the TMC here in Houston. And then for screening, we weren't doing anything really different. We were looking at the number of people coming through. Obviously, we're getting feedback if people were waiting a long time. So we tried to increase screeners, rework the queuing. And in some cases, we just said to staff, look, we know you're used to coming in at this time every day, but be flexible. Give it 5 or 10 minutes on one side or the other of your entry time, and see if that makes a difference on the line. And after a week or two, as volumes change of different groups coming back to work, they settled into a routine that worked really well. And we don't really have large, long lines. And if the line is there and bigger, it moves pretty quickly, and we don't get a lot of complaints.
Wow, that's great. Adaptability. Haven't we learned that over the last 7 months? That's really awesome. So have you had any exactly. Have you had any regulatory agencies or anyone come in and walk through your processes or look at them and then provide any recommendations or anything like that?
Yeah, so we've had a couple groups come through. The first one was we had CMS come through as part of an investigation they were doing on a separate issue, not related to screening. But they were very interested in what we were doing on screening, and they found some things we needed to shore up. It was more around just our SOPs and our training program to make sure that the staff could speak to all of the aspects of the SOP. And where we found some variability was if somebody's temperature was too high, what do they do, versus what does the SOP say, and making sure that was all solidified. You got to remember, these are all volunteers. And the volunteer pool was changing. So you may have somebody that day who had been doing it for weeks and is great, and then you may have somebody who's only been doing it for a few times and they feel a little rusty on it. But we worked hard, and we've been working hard to correct that. The other group was Magnet. So we just received our 5th year as a Magnet organization, and they came through and they looked at more of our nursing processes, but they did look at the clinical aspects of how we screen patients, and they were happy and very pleased with what we did.
Oh, wow. Congratulations on that. That's quite an achievement. Continue that certification, which is awesome. Well,
Yeah,
thank
really
you.
cool.
Yeah, that is so great. Well, I so appreciate you being our first in our virtual series for Education Through Association. I hope this is helpful. I'm sure people probably have a lot more questions, and they can definitely click on the links here in this communications, so that way we can ask more questions and be able to go through that. Thank you so much for your time, and I hope you have a really great day. Thanks, Tapham.
Thanks, Lori. Take care. Thanks, everyone.